Awareness Day. My name is Christy Kane. I am the State Coordinator of Kansas Project Launch based at the University of Kansas, and we're glad that you can all be with us today. We hope that you will join us for other webinars, and after today's webinar, I will give you some reminders about what great webinars we have coming up the rest of the week. And so just if you can see the audio instructions on your screen, and I'm assuming that all of you have had those instructions and that you were able to get that going because you can all hear me. If you have questions or problems during the webinar, then please feel free to type in the chat or question box, and we are going to go over just a couple of things about GoToWebinar so that you'll be familiar with the technology. If you would like to hide your panel so that you can see the full screen, then all you have to do is hit that little red arrow and it will move your control panel off to the side. And then if you'd like to get it back, then you just click on the red arrow again. This is the information about the audio. Please make sure that if you're using the telephone, you have the telephone selected, and I think all of you do, so that should not be an issue. This is the question and chat box, so if you would like to type a question in, you can see where you would be able to type that in the white text box toward the bottom of the screen, and then we will monitor questions and anything you type in the chat box during the webinar. And we are going to be doing some polls today, and so this would be what it would look like on your screen, and all you do is click on the answer and then submit it. Unfortunately, if you are viewing with a group today, you'll have to come to a quick consensus of what the answer is in order to participate. We don't have the capability of doing multiple people who are viewing one webinar. And so with that, we will actually launch the first poll. We wanted to find out who is in our audience today. And so Mary is going to launch our poll for us. And so please go ahead. We will answer those questions, and we'll give you just a few minutes. Or not a few minutes, a few moments to answer that. And so Mary, would you be able to share those poll results with us?
Yes, Christy, we have, I will click share here. We've got 11% mental health clinicians, 16% early childhood education, 11% home visiting, 31% social work, and 31% other.
Okay, and for those of you who are other, if you would like to type in the chat box what your profession is, we would be interested to see who else we have in the audience. So thanks for joining us today. I think we're going to do one more quick poll to get us started, and that would be whether you have heard of mental health first aid before. So we're going to go ahead and launch that one.
Christy, that what we're seeing is that 50% say yes and 50% say no.
Wow, that is quite the split audience today. So, well, after the webinar, 100% of you will be quite familiar with mental health first aid. So I'm going to go ahead and introduce you to our presenter, and we are going to get his presentation set up here. Our presenter today is Steve Christenberry. He is from Family Service and Guidance Center in Topeka, and he's the Director of Clinical Services. And we are really grateful for him to travel to Lawrence today to participate in the webinar, and he has a lot of great information to share with you today. And so I would just like to thank him for participating, and bear with me for just a moment while I get it turned over to his presentation, and then I will turn it over to Steve.
Good morning, everyone. Thank you for getting on the webinar today and taking up your part of your morning time to learn more about this topic. I'm a mental health first aid instructor. We have several of us in Topeka, as well as the other mental health centers. I'll talk a little bit more about that as we go along here. But my main goal today is for those of you who have not had experience or heard about mental health first aid, is just to give you an orientation about it and hopefully pique your interest enough so that you'll want to be able to participate in a training class in your area. There's my information. I think the slides will probably be posted on the website later on, so you should be able to access that. But I'm in Topeka Family Service and Guidance Center, and you feel free to call me or email me if you have further questions as we go along. Mental health first aid basically is designed to help people identify friends, neighbors, classmates, coworkers who might be experiencing a mental health kind of issue, and then understand what kind of resources are out there and how to best get people connected to those resources to meet their mental health needs. I do want to talk a little bit about another type of first aid, just to differentiate it for you. There's another term called psychological first aid, and while mental health first aid is basically like Red Cross first aid or CPR, where the goal is to triage an individual, put a Band-Aid on whatever that injury is, and then refer them for professional kind of interventions. Psychological first aid, on the other hand, is developed by the National Child Traumatic Stress Network and the National Center for PTSD, and it was designed for interventions in the aftermath of a tornado, Katrina, 9/11, those kind of things, where people have experienced a traumatic event and are responding to that by having acute stress disorders, those kind of issues right after that event. It's not designed to be a mental health intervention like mental health first aid is. So there's kind of two different versions here, and just wanted to make sure you understood what the difference was in case you encounter someone talking about psychological first aid. The history of mental health first aid basically was developed in Australia. There was a couple of professionals there that one day had an epiphany and said, you know, we've got Red Cross first aid. Why don't we have something for mental health? So they developed that at the University of Melbourne. It's expanded to a number of countries. It came to the United States in 2008 with the National Council for Behavioral Health Care. In Australia, they did some studies. So this is, really a pretty new, if you think about how research goes, 12 years of a program doesn't give a lot of data, but they did do some randomized trials in Australia that where they found that mental health first aid really did help people have a better understanding of mental health issues, what to do about that, what kind of services are available. And one of the main goals, they talk about reducing stigma. And what that really means is mental health issues are something that you can't see. It's not like a broken leg where you see somebody in a cast, you go, oh, they broke their leg or their ankle or their arm or whatever. Mental health is sort of that invisible disorder where you see people demonstrating behaviors or symptoms, but you can't really see it in the physical nature otherwise. So it's a scary thing many times, and people often view mental illness as a strange, scary thing, not as a illness that is very common. And in fact, the data says that 26% of individuals in the United States will experience some level of a mental health issue in any given year. So that's a pretty huge number of individuals. It could be one in four of us. So we want to make people aware that mental health issues are every bit as real as the flu or a broken leg or any kind of other injury. The goal for mental health first aid is that we really want it to be as common as CPR or first aid is in the country or internationally, in fact. In terms of introduction into the United States, when the National Council brought it over from Australia, they did some pilot sites, and Burt Nash Mental Health Center here in Lawrence was one of those pilot sites. That was in 2008. Since that time, here in Kansas, we have 27 community mental health centers, and in 25 of those, we have mental health first aid instructors. For example, my agency, Family Service and Guidance Center, we have myself and 2 other individuals. Our counterpart, Vallejo Behavioral Health Care, and also in Topeka, also has 3 instructors. So we team teach together to present classes to folks in the community. Right now, there's over 80 community mental health center instructors here in Kansas. There's also approximately 25 providers that are in the Kansas City metro area that are not associated with mental health centers, but there are other individuals who learned about the program and through a grant in conjunction with the Wyandotte Mental Health Center, got a number of people trained there. I don't have a real number of the people who are not in the mental health centers other than that group, but I know there's others throughout the community. Just within the mental health center instructors, we estimate that in this year alone we'll have over 120 classes. And as we teach more instructors, that certainly will increase the number of classes that will be taught across the state. Some of the responses from people who have taken the class, I won't read all those there, but lots of different kind of people take them from all walks of life, and the feedback has been really, really good. There was a class that I taught recently that one of the participants came to the 3rd session and was describing how she had already used some of the strategies that we had talked about during the class. Student feedback, we do a survey at the end of the class. One of the things that National Mental Health First Aid wants to do is research to be able to fine-tune the program, improve it as we go forward in the years here. And the feedback that we get is overwhelmingly positive from folks that have taken it. As far as who can take the class, really anybody. We have had folks from our mental health centers, support staff. I've had nurses from some of the local school districts take it. One of the interesting things is we've had some nursing home folks in our community. In fact, the director of one of those has taken our class 3 times because she wanted to be there with her staff to emphasize how important she thought the program was. So virtually anybody can take it. Anybody that has anything to do with people, even people like firemen, law enforcement, individual HR people is a good audience. So we're really trying to reach out and provide the training to as many people from as many walks in life as we possibly can. There's 2 versions of mental health first aid. The adult curriculum is the one that first came over from Australia, and recently, as recently as December of last year, they announced a new curriculum that's focused on youth and adolescent development and then disorders that are more typical of adolescence. There's been a few people trained in that so far at the mental health centers. There's a training the end of this month and another one in July that many of the people that are trained in the adult version will be taking. And I know in Topeka we have two of those youth classes scheduled in the end of July and then in October. The basic objectives of the class, I kind of spoke to this earlier, but just to understand what a mental disorder is. Understand the prevalence. That was what I was talking about, 26% of the people who experience a mental illness or mental health issue in any given year? What's the impact of that on an individual, on their family, on their coworkers, the population as a whole? What are the signs and symptoms, behaviors that people exhibit if they're experiencing mental health issues? And then just like American Red Cross has the acronym ABC, which is Airway, Breathing, and Circulation, we also have an acronym in mental health first aid. It's called ALGE, and take the class and you'll get to know that. You'll be able to memorize that by the time you're done. But it's a quick way to help remind people of steps they can take and actions when they're working with individuals who may be experiencing mental health issues. Other objectives is to, and the first one here is very important, is understanding signs and symptoms if someone is considering suicide. Obviously that's a pretty acute and serious situation. So what do we do if we see someone that's giving away their possessions or talking about harming themselves or not wanting to live, those kind of things? Also want to help people develop the skills to be able to interact with folks who are experiencing mental health issues. What are the resources out there, both professionally, non-professional, community supports? There's a wealth of programs and services in most communities. The smaller communities obviously have less resources, but communities like Lawrence, Topeka, Kansas City really have many options out there to help people meet their needs. An interesting tidbit is that most people who experience mental health issues, it takes 10 years before they ever seek treatment. It's one of the, it's not something like somebody with a broken leg, they're going to go to the doctor right away. Many times people who are experiencing mental health concerns try to hide it. They don't know how to describe it. They don't know what it means. All they know is they're depressed or anxious or what have you, and they don't seek treatment. Or they go to their primary care doc and talk with them about their aches and pains, which oftentimes are related to the mental health issues, not a real physical issue. One of the things I mentioned, ALGE there, that is the Mental Health First Aid Action Plan. We practice in the classes how to develop those. What do you say? How do you interact with people? How do you identify resources that might be appropriate given the particular need they have?
We had a question come in, so if you don't mind.
Sure.
So someone had asked, what are the costs to getting training, and then if they wanted a training in their community, do they contact you, or who should they contact?
Good question. That was actually one of my later slides here, but I'll go ahead and talk about it a little bit. The National Council is the one who sets up the Train the Trainer classes, and here in Kansas we have the Association of Community Mental Health Centers, so we've been real fortunate in that they've contracted with the National Council to bring instructors in to Kansas to teach people at the mental health centers. So we've worked out a group deal through the association that really has been very helpful, and it has been a reduced cost. I have not been on the National Mental Health First Aid website recently, but some of the classes I've seen in the past where they advertise them, the cost is fairly expensive. It's around $1,800 for 5 days, plus wherever you have to travel to attend it. So if you could get a large enough group of people together, I do know that the National Council will work out arrangements where it's reduced costs, and they'll bring the presenters here rather than having to fly to St. Louis or whatever to take a class. In fact, the classes that we've done here in Kansas, when I was first trained, that's exactly what we did. We had 30 people at 2 different sites here in Topeka and out in Hayes, and then had presenters come in to conduct the training. The youth version training that's coming up in the end of May and the middle of July, we're doing the same thing. So that's one possibility if you can get a large enough group together to bring them in. If that doesn't answer your question, by all means, Chad is here and we'll try to make sure we answer that. In terms of the class structure for the mental health first aid, it's a 12-hour program. We usually teach that in 4 blocks of time that are 3 hours of length. We can do that in 4 sessions, like 4 evenings, 4 mornings, 4 afternoons. We really try to vary it so we can meet the needs of the various audiences. We can also do classes that are 6 hours in 2 days, so 3 hours in the morning, 3 hours in the afternoon. So there's a variety of ways we can do that to try to meet first shift people's needs, second shift people's needs, or whatever the audience is. I mentioned the prevalence of mental illness in the U.S., 26%. That's one of the things, the first things we talk about in the training. We talk about who experiences mental illness. It can be anyone. It's not something that is targeted at socioeconomics, race, ethnic backgrounds, those kind of things. It can be really anybody that experiences it. We talk about what the risk factors for mental illness are. We talk about the whole issue of stigma, and again, the intent is to try to reduce that stigma and that scariness about the topic of mental health issues. We also talk about diagnostic categories, and I do want to emphasize that mental health first aid is not something that we want or expect people to be able to diagnose disorders. That's really delegated to professionals in the field, mental health professionals such as psychologists and social workers and physicians and that sort of thing. But the idea is to give you an understanding of what depression is, what is anxiety, what are the behaviors that someone might exhibit if they are expressing those disorders. Eating disorders, substance abuse, psychotic disorders are topics that we discussed in the class. In the youth version, it talks about adolescent development and then the various disorders that teens might experience. So the idea is to give you an understanding about what those symptoms and signs are so that you can best know how to help intervene and help direct someone to get services that might meet their needs. The other thing we try to impart upon people is how do you talk with somebody who's having a mental health issue? Do you be direct with them? Are you subtle? What are some words you can use, and what are words you shouldn't use? That's often more important. We talked about the resources that are available to treat mental illness, both in general terms of psychology and social work, those sort of things, and then more specifically what resources are available in one's community. Other resources that are more informal, support groups, self-help books. There's a lot of different things out there that people can use to help meet their needs that are more on an informal basis, so we try to identify those and share that information with the folks who take the class. A couple ways you can locate mental health first aid classes. If you go to the Mental Health First Aid website, which is, and I've got it here on another slide, is www.mentalhealthfirstaid, and that's all spelled out, .org. If you go to that website, you can click on a button that says find a course near you. You can enter the city, state, zip code, how far, a distance, 25 miles, 50 miles, or whatever, and then click on find, and it'll look to see whether or not someone in that area has signed up a class on the national website. So that's the first key, is like if I'm teaching a class, I have to post it on there so it can be advertised through there. So that's one way to locate classes. The other way to locate classes is if you, as I noted, 25 of the 27 mental health centers across the state do have trainers and are providing the classes. All you got to do is contact the mental health center in your area, ask for the person who's in charge of the mental health first aid training, and they can direct you to the dates when a class is scheduled in their area, where it's going to be. And typically people do the classes either at the mental health centers or they may do them in locations in the community. We've done 2 or 3 in Topeka at local churches, so we can accommodate people's needs by doing them on-site at our center or doing them off-site at another location, as long as there's audio-visual equipment and that sort of thing. I would note that in order to have a class, there's a lot of discussion, interaction. We do exercises in the course of it. So really to be able to have a very interactive class, typically we require at least 12 to 15 participants in order to schedule and conduct a class. Is there a cost for these classes? Well, that really varies. Most of the centers that I'm aware of are charging somewhere in the neighborhood of $25 to $30. We really see this as a public service. Participants do get a manual, and so the cost there really is primarily to pay for the cost of the manual and then other expenses, snacks, and that sort of thing. In Topeka, we've been fortunate enough to get a couple of grants that allowed us to cover the cost of several of our classes. So if there's that kind of support, you might be able to get into a class with no cost at all other than your time. Otherwise, again, it's usually $25 to $30. As far as what you need to bring to a class, as I said, you'll get a manual, very detailed. We get a lot of good feedback about just receiving the manual, in addition to the information that people learn while taking the class. Pad, pen, take notes, and then the most important thing is really be having an open attitude, willing to participate in the activities, the exercises we do, participate in the discussions, really to get involved in the class, and really adds to the learning environment if all the parties that are there are interacting with the instructors and with each other. In order to complete the class, you do have to complete all 12 hours. There's a completion certificate that we issue at the end of the class. Certification is good for 3 years. We recognize that sometimes, based on the busy lives we all have, that people may not be able to take all 12 hours of the first class they sign up. So I know in Topeka what we try to do is accommodate people by allowing them to come to another class to finish the other 3 hours or whatever the session they missed in the initial class, because we really want people to get the completion certificate and have all that knowledge about what to do with mental illness and the people they meet. In terms of putting it to work, you can use this, the strategies here, day-to-day lives. We all interact with people all the time, and again, 1 in 4 of the people that we meet potentially might have a mental health issue. So it can be something that we use with coworkers and or peers, students, or friends, family, neighbors, whatever. Again, I want to stress that mental health first aid is not therapy. And we're not counselors, we're not therapists, we're not psychologists, unless that's what we do for a living. So the idea is to help get people, put that Band-Aid on their mental health issue and get them directed to the services and interventions that are most appropriate for them. We talked a little bit earlier there about instructor training. About anybody can be an instructor. That's one thing that's really valuable with this training, is that you don't have to be a social worker, you don't have to be a psychologist, you don't have to be a nurse, a paraprofessional, a parent, a student. Virtually anybody that has teaching skills, the willingness to be able to stand up in front of a group and talk. That's one of the things we talk about on the top of the top 10 list of fears, an anxiety, stress-provoking situation is public speaking, so you certainly need to have the ability to do that. But other than that, just having basic presentation skills is very, very helpful. And if you've got that experience, that is help get you started. But again, I want to stress that really anybody can be an instructor here if they are willing to take the class, take the training, and then willing to get up in front of a group of people and do the presentations. Again, National Council on Behavioral Health Care. The last slide here does have the contact person's information, and you can also get the information on the Mental Health First Aid website. So you can check that website for details about when classes are scheduled, and they do those all over the country. And again, the website for that is mentalhealthfirstaid.org. In terms of what the instructor training is 5 days long. The first thing that you do in that class is actually take the class as a student, so you have the perspective that a participant would have as in the role of a student. After that, we go through the class. The instructors go through each section, talk about things to stress, things not to stress. They assign segments of the class, and then we do peer teaching, so we all have an opportunity to actually do presentations of segments of the class to the other participants in the training. So usually they like to have 15, 20, up to maybe even 30 people in the instructor training classes, so that you really have an opportunity to provide that training and get feedback from your peers there. After graduation, you get access to a portal on the website that allows you to go in and access electronic support materials, sign up the classes, register the classes that you're scheduling out into the future. And there's also a mental health first aid blog, so instructors can communicate with one another, have a lot of support from the folks all across the country. Thought this was an interesting quote. Mental health first aid, with its focus on recovery, has the power to transform communities, power to change beliefs, and the ability to connect people in ways they never would have connected otherwise. So again, reducing the stigma of mental illness, making it a real thing instead of some scary, unknown, invisible kind of thing. It's very, very important, and this class has every ability to do that. Again, there's a website for mental health first aid. I encourage you to get on there. Anybody can get on there and look up a lot of the information, search for courses, those kind of things, and find out about available classes across the country. Now, time for questions.
So Steve, we'll go ahead and monitor questions, and I think while we're waiting for people to type in their questions, we're going to go ahead and launch the next poll. So Mary, if you could launch the next poll asking about if people are interested in taking this training. We'll go ahead and launch this poll. We have a couple more polls right now, and then we'll watch for questions.
Okay, Christy, we have quite a few people who say very likely or somewhat likely, and then we have about 18% who are not as likely to be interested.
Okay, great, thanks. And then can you go ahead and launch the poll to see if people are interested in becoming trained as trainers?
Christy, we have quite a few yeses and maybes, and then a couple of not interested, in about 44% not interested, 17% say yes, and 39% say maybe.
Okay, that sounds good. So, Steve, just to clarify, if someone's interested in being trained as a trainer, they should get on the Mental Health First Aid website and find a course where they could travel to, unless they had a group of people who were interested in being trained.
Right, and in that case, they can get a hold of the National Council folks or contacts that are on the Mental Health First Aid website to inquire about how to get that set up.
Okay, and then if I was interested in just having a training in my community for just a variety of professions, is my best route, say I'm in western Kansas, is my best route to contact my mental health center?
Right. I don't really, well, one thing that you could do is also get on the Mental Health First Aid website and contact them to ask for the information, instructor information, and who to contact in the area you're in. But certainly the mental health centers are an avenue where we know that there are over 80 trainers across the state. So if you contact the mental health center, you're sure to be connected with somebody that can tell you about classes.
Okay, great. I think we've had a couple of questions come in.
Steve, what has been the most surprising thing to you since getting involved in mental health first aid?
That's pretty interesting. As a mental health professional, when I first started, when I took the training, the instructor training, and then started teaching the classes, my first impression was the information seemed a little bit simplistic, but then I realized that that was only because it was coming from my background, 20, 30 years in the mental health field, and the fact that I'm a psychologist and that's what I do for a living. And then when I realized that, had that realization that most of the people we train are not mental health professionals. They're people that work in nursing homes, they're people that work in the schools, they're support staff people, all kinds of individuals like that that don't really have any kind of a background or exposure to mental health issues, except for maybe having a family member or maybe personally having experienced some mental health issues. So I think it was kind of an eye-opening experience when I started seeing the feedback from the people who were taking the class, how much they felt they gained from it. And even though from a professional, mental health professional perspective, it did seem a little bit simplistic to me, but the response has been phenomenal.
Is there a youth class in Kansas yet?
Yes. We have 2 scheduled in Topeka, and the 3 instructors at Family Service and Guidance Center will be going to the youth training middle of July, and then after that we'll be able to start teaching those. I've actually got those just posting those on our websites at Family Service and Guidance Center and Vallejo, and sending them out to our distributions list. There have been a few of the people from the mental health centers who have already taken the youth training. National Council's conference was about 3 weeks ago, and I know that some of the mental health folks from the community mental health centers actually took the training at the council, at the council's conference. So they'll be posting classes in their local areas. I do know that they're teaching the Train the Trainer class for the youth version the end of May, and then the one that we're going to in July, and there's something like 60 people signed up to take those trainings. So after those are completed, I'm sure they'll be offered across the state.
Thanks, Steve. Would you be able to define the ALGE acronym?
That's pretty long. It's basically it's five fairly long sentences. But like the first one, assess for suicide and risk of self-harm. So the most important thing is assessing people, listening non-judgmentally, give reassurance and information, and the last 2 are related to encouraging people to get professional help, and then encouraging people to get informal kind of help like support groups or self-help books and those kind of things.
Okay, thank you. You covered a little bit of this, but if you become a trainer, how much time and travel is involved in that? I don't know if you can speak to that.
Yeah, good question, and I'm glad you brought that up, because I didn't. One thing I didn't say, and one of the requirements to be a trainer is that you teach 3 classes a year. So in order to keep certification, you have to teach 3 classes, and that can be the youth version, it can be the adult version, or a combination. In terms of travel, that really depends on the instructors. And for example, the community mental health centers all have a geographic area that we're responsible for. Burt Nash, for example, here in Lawrence is Douglas County. Vallejo and Family Service and Guidance Center, and is at Shawnee County. So generally speaking, the instructors teach locally, but it's not unheard of that we might go to another area where, because you really need 2 instructors for each of the classes. So if somebody needs assistance in Cowley County, because they don't have a second trainer, then and they might ask me to go do it, I'd be willing to do that. So, but mostly it's local training in your community.
Super. And finally, the last one coming in here is, do you, Steve, have a resource list that you're able to disseminate for different counties, resources in different counties in Kansas?
The local mental health centers are probably the best avenue for that. For example, I don't know what all's available in Great Bend, but the mental health center in Great Bend does know what's out there. So communicating with your local community mental health center, and as I said earlier, one of the things that we do in the classes is talk about what the resources are in our local communities, and try to give people a list of not only the local resources, but websites across the country, those sort of things that are better supports. But we kind of try to do that on a local level.
Okay, Steve, we had another question, and I don't know if this is diving into the curriculum. We're trying to get the curriculum right from you today, but can you talk a little bit about words you should and shouldn't use with people who are experiencing an issue?
Yeah, one of the things that we talk about in the class is oftentimes the best support for somebody that's under a great deal of stress or experience some kind of issue is just to be quiet and be there and have a presence. Some of the things not to say to people is, I know how you feel, because we may think we know how they feel, but we're all different. So putting those kind of words out there, and we often do that because we don't know what else to say. So some of the best things to do is, what can I do to assist you? May I help you? It appears that you're really struggling here today, or you're really stressed out. Is there something I can do to help you? Let them tell you what they need. Try to encourage that, because that's one of the problems with mental health issues. And I mentioned earlier that oftentimes people, kind of the average is 10 years before they ever seek treatment. Well, partly because they don't know how to verbalize what they're feeling, and they're attributing to physical health kind of issues, and trying to look through that as a mental health first aider and encouraging them to talk about what they're experiencing and having their feelings. But don't put words in people's mouths. You know, somebody that's grieving a loss of a family member or whatever might become very depressed or might be very anxious, but telling them you know how they feel really may not be the truth for them, because you can't put yourself in people's shoes that way. And we do have a list of, during the course of the class, we talk a lot about words to use, words not to use. So come take the class. I think you'll find it very helpful.
What ages does the youth version cover, Steve?
Good question. It's targeted at kids from 12 to 18, and I should emphasize that the class isn't for 12 to 18-year-olds. It's for adults who want to know about developmental issues and mental health issues that a child from the age of 12 to 18 might experience. I don't think I said that earlier, but it's, again, the class, it could be teachers, it could be people who work at the Boys and Girls Club, anybody that has things to do with children, adolescents might find the class helpful.
Okay, which kind of leads into our next poll. So, Mary, if you could launch the poll, we're interested to see if there might be the possibility to work with Mental Health First Aid to develop a child version that would be for younger children, and we're interested to see what you think the need is. So Mary's going to launch that poll.
Well, Christy, it looks like 100% of people think that there would be a need for a children's version of Mental Health First Aid.
Sounds like we need to pass that information to the National Council about maybe they'll develop that. I've not heard them talking about that yet, but and again, they just came out with the youth version in December, so perhaps they'll follow that up with a child version here in the future. But thank you for the question.
And I would just add that the evaluation is being conducted by the University of Kansas School of Social Welfare, and so we are planning to meet with them and we'll definitely pass along that there is a huge interest in seeing a children's version. So anything to add, Steve?
I don't think so. I just encourage you to take the class. I think it's helpful for people of all walks of life. Share the information about it with your friends. Post a website. People can get on there and learn more about it. And then, again, check with their local community mental health center to determine when class dates are scheduled.
Okay. Well, thank you so much. We're going to wrap up here. I have a couple of additional slides just to share some housekeeping information with you. So just bear with me for one moment while I switch over presentations. And so you can see that we have upcoming webinars, and Kansas is the only state that does a webinar series for free professional development for National Children's Mental Health Awareness Day, which is actually Thursday, May 9th. But tomorrow we have Healthy Moms, Healthy Babies, which is a program to address domestic violence and the impact on children. And Linda Bullock from the University of Virginia will be our presenter. On Wednesday, we have a presentation about autism spectrum disorders from Luann Renner at University of Kansas Medical Center, and she'll talk about the changes related to autism spectrum disorder and the DSM-5, as well as give you some really clear hands-on advice on how to work with families who are affected by autism spectrum disorder. And then on Thursday, we'll have our Early Childhood Forum, which for those of you who are familiar, we have both in-person and virtual early childhood forums 4 times a year. And so this obviously will be our virtual forum, but we'll have a legislative update, and we will also have a presentation from Neil Sharma from the Alliance for Children's Education, just giving some advice on how to build partnerships between early childhood and businesses. So we hope you'll join us for that. And then finally on Friday, we have presenters from Arizona who are going to share information about court teams for infants and toddlers. And I had the opportunity to travel to Arizona earlier this year and see a panel of presenters talk about their court team, and it's fabulous. So I really hope you'll be able to join us. It's really looking at differential responses for infants who are in the child in need of care system and looking at that based on attachment and relationships as opposed to, just doing things a certain way because that's the way we've always done things. And so I hope you'll be able to join us for those. To register for any of the webinars, you can go to our keccs.org website, and we will also be posting the handouts from the presentations there, and there will also be recordings. And so if you go to a webinar and maybe have a colleague who wasn't able to join and you would like to share the link with them, those are available there free of charge. So I would encourage you to do that. Or if you wanted to go back and hear something again, those will be available. Give us about a week to get those posted, and we will take care of that for you. And then finally, you'll receive a survey from each webinar that you attend via SurveyMonkey that will just help us ensure that the webinars are meeting your professional development needs, see if you have any future topic ideas. So please fill that out when you receive it. And if you're interested in receiving a certificate of attendance for the webinars, just send me an email and we can make sure that you get that. And as I mentioned, there's a recorded version of this webinar and handouts available on the KECCS website. If you have any questions about anything this week, please feel free to give me an email or give me a call. My information is up on the screen, and unless there are any other questions or comments, I think we are ready to wrap up. If you have a last-moment comment or question, please feel free to type it in. But we'd really like to thank you for participating today. We hope the information was helpful, and we look forward to your participation on future webinars this week and some other webinars that we offer. So thank you very much, and we look forward to talking to you tomorrow. Have a great day, everyone.